Good afternoon, everyone. Thanks for joining us on the media briefing for this Wednesday. We're going to get started with some great news from our Department of Social Services and the United Way. You may have been hearing about this already on social media. We've got folks here to talk about the Emergency Rental Assistance Program. And we've got Lauren Suansupa with the Department of Social Services. Also joining us from United Way are Katie Castagna and Josh Madfis. Thank you all for being here today. Lauren, I'm not sure which one of you is going to get started. Lauren, should we start with you?
We'll start with Lauren.
Thank you so much for having us, Maya. I believe, Katie or Josh, if you want to share anything.
Sure. We have a brief presentation, and we're happy to do that. So I didn't know if you wanted to introduce us, Lauren, but we'll
Oh, yes. No, I definitely would
here.
love to. Thank you. Lauren Suansupa from the Department of Social Services, and we are so excited to be able to share about the county's emergency rental assistance program that is going to be operated through United Way and their system of partners. And we're going to talk a little bit more about how this funding can be accessed. But I kind of want to just briefly share a little bit about how the funding came into our community and how the both federal funds that was provided through the U.S. Treasury of over $12 million combined with some state funds that also came in, just over $15 million are combined and are being passed through to United Way to help support this this huge need that we know of in our community. And so while the funds came in through the Department of Social Services, we're really thankful to have a partner like United Way and to leverage their relationships in the community, their systems like 211 and their ability to really connect and provide great access to those in our community so that people can access this need. So I want to turn over to Katie Castagna, the President and CEO of United Way, and Josh Madfis, the VP of Community Investments, to talk about how you can access the support.
Thank you very much, Lauren. We're really excited to be here today to tell you very specifically what this program does and how people can access it for assistance. First off, I want to thank the county and the great partnership with both our elected officials as well as the county staff to be able to provide this assistance. We have had a very successful pilot of this model last fall with the CARES Act funding. The county invested $1.25 million in rent and utility assistance in October through December. And so when this new opportunity came forward, it seemed to be the logical next step to scale up what we had successfully piloted in the fall. So as Lauren mentioned, this opportunity consists of two pots of money, the initial one from the U.S. Treasury Department, and then the second and larger portion coming from the state through SB 91. And the overall goal is to prevent homelessness and address the economic impact of the pandemic. And we know at United Way how great this impact is through our call data for 211. We know that people have been consistently needing help paying the rent. And there have been smaller programs that come and go, and the funding seems to be soaked up as quickly as it arrives. So we're thrilled to be partnering on this much larger program. And Josh will be talking about specifically how it will be rolled out. I do want to make a couple of comments on how Monterey County is differentiated from the state of California. So you may have seen the statewide Housing is Key campaign that launched on last week, March 15th. And in some areas, people can access this funding support directly through the state administered program. Here in Monterey County, our Board of Supervisors really wanted to go with a more local model. And again, based on what we knew we could do with our local jurisdictions and nonprofit partners, they decided not to go through that state portal. So this is important to understand because it's confusing if you see in the media beyond Monterey County, this other program. What we want you to know is that anybody applying through that program would be redirected to ours. So the same assistance is available to Monterey County residents, but just through a different delivery model. So that's one thing I wanted to point out. The other thing is that we officially launched yesterday with the approval of our Board of Supervisors. And there was some discussion and really a key point for our implementation of this program had to do with really cash flow. How do we make sure we have the funds in the pipeline to meet this very aggressive spending program? Because we need to spend 28 million not only by December, but most of it needs to be spent this summer. So what we have done in our model is looked at how to front load that support and make sure that we have partners who can start paying rent immediately. And so because of that, we needed to request an advance on this contract with the county. And so yesterday that advance of $7.1 million was approved. And if you think about for example, our spending plan, we have to spend $3.5 million a month in order to meet these objectives and not have the state or federal governments take it back. We need to make sure that the agencies have that money to pay and that United Way has the money to pay the agencies and so forth. So that was really the purpose of the advance, to make sure that the funding pipeline could flow as quickly as possible. And the other thing is that we essentially soft launched this program last week. As I stated, we always have people calling 211 for rental assistance. Word got out that this program was in the mix, and then we really wanted to be able to start taking applications in a preliminary form once the state program launched, because there's been really a lot of pent up interest and anxiety around this. So even just in that first week of the soft launch, we were able to do intake and application processing for 450 residents. So that's just a sample of the demand and interest that we have. And so now that we're formally approved and we'll be able to get funds flowing, the program is up and running. So I'm going to ask Josh to take us through some of the nuts and bolts of how the program works and how people can access the assistance.
Thanks, Katie. So as Katie mentioned, the goal of the program is really just to get immediate and emergency rent and utility assistance to eligible low-income residents who have been affected by COVID and have lost some income due to the crisis. Our strategies broadly are to partner with community benefit organizations throughout the county, so cities, colleges, nonprofit organizations, to use the 211 information and referral call center to screen residents, have them do a registration, and then refer them to these agencies that are paying the benefit. We also have an online application where folks can self-register and self-refer, and then sort of coordinate these relief efforts through this smart referral software that we've developed. And that's been really helpful in just sort of building the capacity of our community benefit organizations, standardizing the process, sending referrals, and being able to do some just real-time monitoring of the program and reporting on how it's going. In terms of eligibility, as I mentioned, it's for folks who've lost employment or income due to the pandemic, and it's for folks who are 80% of the area median income. We are prioritizing folks at 50% AMI, but 80% can qualify as well, and they have to live within our county. So the process is this: residents can call 211, and a call specialist will log into the smart referral software, pull up that registration intake survey, and determine if they're eligible. If they are, they'll send an electric referral to one of our, currently we've got 13 agencies countywide who would receive that referral and then work with the client to upload the documents that they have to show to prove that they're eligible, and then they would go ahead and pay the utility company or the landlord. They would also make referrals to other health and human services to address longer term needs that the folks might have. But folks can also go to mcrenthelp.com and they can self-register and just do it on their own through a mobile device or a computer, and again refer to one of these agencies for the same process. I think a key caveat to this program that wasn't that was new from last year is that for landlords to participate, they have to be willing to accept only 80% of the rent that's owned, and that's mandated by the state of California. So these are the documents that folks have to bring, and so once they get that referral, they'll get an email with this information as well. But they would need a government photo ID with name or birthday, and it can be an ID from a government outside the United States, and then they would have to demonstrate they're below 80% AMI with these things like tax returns or pay stub or W-2, unemployment award benefit, and so on. They do, if you can't find any of these documents, then there is a self-certification form that they would use to attest that they're below income, and that form is standardized, and we make it available through our partner agencies, and I think it's on the web software as well. They would need a lease or a letter from their landlord, the utility bill, and then a W-9 and tax information from the landlord. We have developed a landlord verification form that we work through the assessor's office just to make sure that the landlord is associated with the property, and then a form that demonstrates the consent from the landlord that they're willing to receive 80% of the rent owed. So the benefits, I mentioned that it's rent and utility assistance. Folks can get up to 12 months of assistance with this funding, and that can be rent assistance and or utility bill assistance per household. The spending period, it covers payments from March 18th of last year to the end of March of this year. For utilities, it includes water, sewer, trash, and electric. It also can cover 3 months of future assistance, and that's for the paying not 3 months at one time, but 1 month ahead. So if folks know that they're not going to be able to pay rent in the future, then they can get 25% of future rent paid with this as well. If the landlord doesn't want to accept the 80%, only 80% owed, then the tenants and or the landlord can receive just 25% of what they owe, and that's to sort of mitigate or prevent them from being evicted. We have created some measures to prevent fraud, and so there is a duplicate benefits prevention. And so when people are entered into our system, when they've received a payment, a unique identifier is created. And so that would prevent them from going to another agency to get paid twice, because they would be pulled up as already having received the benefit, right? So they couldn't reapply with another agency. We have some recapture policies that has some contingencies if we've established that there has been some fraud, and so we have a process to request the funds be returned from the landlord, tenant, or utility company. Request the checks to be stopped, or request a bank affidavit to sort of stop the check process. And then again, we've got a landlord verification process through the assessor's offices throughout the county. So the key program dates, our soft launch was the 15th, a formal approval from the Board of Supervisors yesterday. The state spending deadline is August 1st of this year, and the federal is December 31st. So as Katie mentioned, there's a real race to spend the money. So these are our current list of participating agencies. As I mentioned, we've got cities as well as schools and nonprofits. We've got 3 partners that are supporting all residents countywide. And so, if someone is outside one of the participating cities, they could contact or get referred through Central Coast Energy Services, Goodwill, Central Coast, or the Salvation Army for rent and or utility assistance. And just finally, for reporting, our tool helps us to really sort of keep a real finger on the pulse of the inquiries we received, that the number of those inquiries that result in assistance, the amount of assistance provided, and we can see, how it's been provided by race and ethnicity, by city, gender, age, and income. And then we're working on just standardizing our media and our education and outreach of the program. So we've got public presentations with landlords just to raise awareness and make them understand that this is a valid program and answer any questions they have. Regular meetings with our participating community benefit organizations and other community benefit organizations, and allowing them to use the software to refer their existing clients to these agencies that are making payments. And then also regular meetings with policymakers. We have developed a press release and regular sort of social media and other sort of standardized marketing tools for the program. And as Katie mentioned, to date, we've got 403 rent referrals, 106 utility bill referrals, and that's just as of March 15th. And that's pretty much it. So we would love to answer any questions if there are any right now.
Thank you all very much. That is just great news, just such great news. And boy, the numbers for a soft launch, pretty impressive. Lauren, do you want to add anything before we go on to our next, any wrap-up comments?
I just hope that people, hear about the program, please share about the program, let landlords understand, what some of the rules and purposes for the program are, and please reach out. The help is here, and there's plenty of funds that we have available. It's not going to run out anytime in the next month or so. So please make sure, reach out, and help is here.
Thank you all very much. And if you all could stay for questions a little bit later, that's great. We have another program to talk about, and this is an isolation stipend program. Besides people needing help with their rent, there are people who need assistance to isolate if they're recovering from COVID-19. And Krista Honey from the Health Department is joining in, and Lauren, we're going to keep Lauren on a little bit longer to talk about this program. It's just so great to hear all these assistance programs beginning to come to life.
It is great, Megan. So thank you for giving us the opportunity today to review with the press about this program. And this one is, as you mentioned, is through the Health Department, but it really, the money is approved by the Board of Supervisors, and then we share it through United Way and the referral network software. And I'm wanting to share to present. So let me see if I can present here. It won't let me present.
Oh, I think you need to open it in the desktop app.
Open it in the, oh dear. Do you happen to have it downloaded, Lauren?
I think I do. Let me see what I can do to do this quickly.
But as you do that, so there are actually two programs to help people with an isolation stipend if they need to isolate and quarantine. And this is for people who test positive. And so the funding was approved by the Board of Supervisors, and we had our launch on the 15th of last week for the Health Department program. And this is where anyone who has gotten tested on March 15th or later, and they have to be basically less than 50% of their isolation period already, because we want to be helping them to isolate safely. And they are needing to have a place to isolate. Hopefully that is their home where they can safely isolate away from other family members. And the information that we require from them, their eligibility, is the same as when we did this back in December. It's just now that that ended on December 31st, and now we're continuing from March 15th through the end of June. And what we have is just a couple more back, Lauren, if possible.
Yep, I am struggling with lots of slides on me. Apologize. Here we go.
That's okay. So once they're if they're positive, it's a one-time financial assistance. Some of the eligibility is that, they haven't received other income assistance, such as paid sick leave while they are taking their 10 days of isolation. They have to be from certain zip codes. They have to be 18 or older, and early on in that isolation period, because we're going to continue to follow up with them to ensure that they're isolating safely. What's exciting is that this particular eligibility may exclude some people. It also may not work for some people if it's harder for them to isolate at home. And that's where DSS also has a isolation program that will work in partnership to ensure people have the best support possible to help them to isolate safely.
Right. So for those who are not able to isolate at home, the county has been operating our alternate housing sites, and that is a safe place where people can go if they're sharing a home with others who are not COVID positive and just need a safe place to go. And that comes in the form of either a hotel room or a travel trailer at a safe site within the county. For the stipend program, this one is specific to supporting the Housing for the Harvest. Housing for the Harvest is a component of a program that is specific for those who work in the agricultural food processing industries, and this provides support so that they can isolate in a safe space if they are COVID positive. But an expansion to this program was recently released by the state, started last week. The expansion now ensures that those who choose to come into the program can either come in through and stay at a hotel or choose to stay at home. And either of those options, they can have some support to be able to do that. So while they're in isolation, whether that's at home or at a hotel, they can be provided with 3 meals a day or the grocery equivalent, have access to wellness checks, including telemed consultation with a doctor if they need, support so that they don't need to leave their home or the facility so that they can continue to safely isolate and protect the community, so personal laundry. And then as Chris was talking about, those financial stipends. Should they complete their isolation period properly, they can receive a stipend of either $500 or $1,000. Those stipends don't have some of the same eligibility requirements that, as Krista had mentioned about the specific zip codes and such. Really, for the eligibility for the stipends for Housing for the Harvest, it is exclusive to those who are working in the food processing and agricultural industries. So that's the number one qualification. And then 2, that they're able to safely isolate. So if they don't have that safe place at home, that they come into our program either through a hotel or a trailer park, or that hotel is at no cost to them and they can receive up to $1,000 for that. Or if they are able to do that at home, where they don't share a bathroom or a kitchen or any living spaces with persons who, unless that person also has COVID, they can receive up to $500. And that comes along with all of the additional supports that I had mentioned. And again, just making sure they put out there, the information is kept safe. You won't ever be asked about your immigration status.
That would be the same for the health department program as well.
So, I think the key piece is just letting people know about, there are options out there. If you're able to safely isolate at home, there may be financial stipends that are available to you, either through the health department's program if you live in those certain areas and qualify, or through Housing for the Harvest if you work in food processing or agriculture, and that there are options out there. And if you have some questions, that you can reach out to the COVID call center in regards to how to reach those services.
And I should say, the one thing to add is that, so there are various participating clinics. If you want to go back to that slide, just like there were back in December, the same clinic systems, health department clinics, Soledad Medical Clinic, Clinica de Salud. And then if they get tested at OptumServe or another testing site that's not included, that's where we have the health department call center number they can call, and we will do the referral. And then a big shout out and thanks to United Way. We're using their smart referral software to help with that. And it really helps us keep track of everybody. And we'll be coordinating our referrals along with DSS's referrals just to ensure people get access to the stipend that they need that meets their needs and to help them to isolate.
And I think just in adding to that, just making sure that we're putting out that messaging that, you know, COVID is still out in our community. Please get tested. If you need a place to isolate, there are resources available to you. If you're able to do that at home, those options. But if you're not, that there are services here to support you and help you isolate properly so that you're not exposed to, you know, out into the community, and that potentially you may be eligible for some of these stipends to help ensure that you're not losing out on the income that you need to survive.
Thank you both very much for that information. I think it's really good to remind people, Lauren, as you said, COVID is still out there in the community. We hear so much about vaccine, we forget that there are still a lot of people who are not vaccinated and are at risk and are getting COVID-19. If you would both stay on the line for questions later, that would be wonderful. And now we're going to move on to Rick Encarnacion, who's the acting bureau chief from our Monterey County Health Department Environmental Health Bureau. We're going to talk a little bit about in-house dining. With the red tier comes the ability to go back inside a little bit for dining. And Rick, you've got some good information for operators today.
Yes, thank you, Maya. Good afternoon, everybody. Rick Encarnacion, Acting Bureau Chief for the Environmental Health Bureau. I'm here today to provide some guidance and interpretation for the red tier, tier 2 for indoor dining. As we know, well, we've moved into the red tier last week, which allows now for indoor dining. The limitations being 25% capacity or 100 people, whichever is fewer. We are utilizing the fire marshal's room occupancy rate. It's usually posted on the exit, near the exit of the dining area. Utilizing the fire marshal's room occupancy number, it's just a common practice throughout different counties in establishing what's required here. What is also required, as you can see by your screen, on my screen, that if there are any performers in the room, they should be counted towards that number. However, the health department, we're recommending that restaurants consider counting their employees as a recommendation. It's not required to count the employees, but we like to encourage restaurants to consider them in the count for their own safety. As like what the other speakers have mentioned, and as what you'll probably hear from the following speaker, we still want to encourage people and remind people the basics for COVID. Wear face covering when appropriate, social distancing, hand washing, don't go to work when you're sick, and also have and follow a plan. So with that, that's basically what I'm here to say. If you have any questions, I'm available. I think May is on mute.
I am on mute. Okay, I'm dinged for the day. Thanks very much, Rick, and I'm hoping you'll stay on the call for questions. And now we'd like to turn to Dr. Moreno for an update on COVID information, new numbers, whatever he can provide. Hi, Dr. Moreno.
Good afternoon, Maya. All right, let me get started here. So let's see. All right, so I just have a few things to update the public on today in the media. First of all, as far as our metrics are going, our case rate continues to decrease. Our test positivity rate continues to decrease. And those are two state metrics. So those are the test positivity rate decrease is an indication of decreased transmission of the virus that causes COVID-19 here in Monterey County. And our hospital ICU beds continue to remain available at this point, which is good. About 44% of the ICU beds are available, so the hospital ICUs are not strained as they were back in January. Testing turnaround time most recently is on average 1 day on average for people here in Monterey County that wish to get tested to see if they have COVID-19. And we are approximately at 28% of people 16 and older having received at least one vaccine in Monterey County. Our, as I mentioned, our case rate and positivity rate are decreasing, but if we really want to decrease transmission of COVID-19, we need to continue to do what I think Rick was pointing out. We still need to wear face coverings, keep our distance, avoid other households, wash our hands frequently, get vaccinated when people are eligible, and get tested if appropriate. With regards to the blueprint specifically, we are in red tier, and we have our case rate and test positivity rates as of yesterday, as reported by the state, meet the state's blueprint orange tier criteria. So we have we've met 1 week of eligibility. We would need to have 2 weeks of eligibility in orange tier in order to be considered to move into the orange tier, and we would need to be in red tier for at least 3 weeks. So if people can continue to do what got us into, continue to do what was able to successfully reduce our case rate and positivity rates, then we may be able to keep our case rate and positivity rates down, which may mean the state may consider moving us into orange tier. The earliest could possibly be, I believe, would be April 7th. That really depends on how well people over this weekend and in recent weeks continue to take measures to reduce the spread of COVID. As people know, schools, some schools are open. Those that aren't can open for in-person instruction. They just need to post this is through 12th grade, they just need to post their COVID-19 safety plans on their website, for at least 5 days prior to opening. And the state recommends that the schools maintain 3 to 6 foot distance between students while they're wearing masks in the classroom. And they continue to recommend that teachers keep 6 foot distance between themselves and students, and that if someone does need to remove their mask, for example, to eat their meal in the cafeterias, for example, that they keep 6 foot distance while their face mask is off while they're eating. As far as testing, we do have a decrease in, continue to have a decrease in testing rates, which reflects in part a decrease in interest in testing. It might be because fewer people are sick with COVID at this time. But there are still reasons for people to get tested. It should be anyone who has symptoms of COVID-19 should get tested, even if they've had COVID before or they got vaccinated, because there are variants out there of the virus that can cause a recurrent illness due to COVID-19, which it can infect somebody else. So if you have symptoms, stay home and you should get tested. If you've been in close contact with someone who had COVID-19 or symptoms of COVID-19, that's another reason to get tested. Individuals who can't work from home and have to be in the workplace should get tested periodically, especially if it's recommended in state guidance. And also anyone whose provider recommends they get tested should get tested. We do have news now that the B.1.429 and 427 variant of COVID-19 virus has been switched over from a variant of interest to a variant of concern, and that is because beside the percentage of infections that are caused by this increasing, it also appears to be more transmissible, meaning if someone's infected with this variant of the virus, they can more easily spread it to other people. And based on the most recent genotyping that we've done in our public health laboratory, we've been able to come into an approximate range of what the percentage of individuals in Monterey County that have COVID-19 have this particular variant. And right now, our range is 30 to 70%. It's based on a small number of specimens that have been genotyped. And as we do more genotyping, the numbers of specimens genotyped will increase, and we'll be able to narrow this range and share that with the public. But it's here, and it appears to be more transmissible and spreads more easily. So really need to keep our distance, wash our hands, wear face coverings. As far as implementing the state's vaccination plan, this week there's no change to the individuals that are eligible for vaccine, and we have that information on our website. As far as distribution of vaccine doses, the state has goals for counties to prioritize vaccine doses to vulnerable populations, and that includes looking at the Healthy Places Index quartiles, and for each county was directed to use their vaccine countywide to try to get 40% of the vaccine into people living in quartile 1. That's the quartile that includes communities that have living conditions that lead to poorer health outcomes compared to the other quartiles. So 40% to quartile 1, and 20% to quartile 2, 20% to quartile 3, and 20% to quartile 4. So we have been doing this, and we were able to work with our providers to get vaccine to those providers who are serving people living in zip codes that are in quartile 1. And we've been able to, as of the last week of reporting, which ends March 20th, we got countywide approximately 30% of our vaccine went to people living in the quartile 1 communities. So the state's goal is 40%. We're increasing that. It was about 18% about a month ago. We're up to 30%. So we're working towards meeting the state's goal there. We have our own local efforts to equitably distribute vaccine doses. We continue to monitor dosage by region and by race and ethnicity. And at this point, I could say that by region, and in the last week, we've been able to get doses to regions of the county that are proportional to that population. So for example, North County represents 12% of Monterey County residents, and they received 11% of the vaccine last week. The Peninsula represents about 33% of the population, and they received 30% of the vaccine. The Salinas area represents 37% of the population, and they received 39% of the vaccine last week. And South County represents 18% of the population, and they received 20% of the vaccine last week. So as we continue to work with our many healthcare providers out there that are vaccinating, in addition to public health vaccinating in our clinics, it appears that we're getting, with time, continue to get closer and closer to more equitable distribution by race, ethnicity, and by region. Let's see. As far as race, ethnicity, as mentioned, the data shows that African Americans represent about 2% of the population. Last week, they received 1% of the vaccine. Asian and Pacific Islanders represent about 6% of the population, and they received 7% of the vaccine. And Latinos represent 61% of the population, and they received 64% of the vaccine. And white non-Hispanics represent 28% of the population, and they received 25% of the vaccine. So again, both by region and by race ethnicity, we are getting closer and closer to having more equitable distribution of vaccine. And I'll end with information about the third-party administrator. We have we know that the state and Blue Shield, the third-party administrator, have both stated that in order for a vaccine provider to receive vaccine and administer the vaccine to individuals here in Monterey County, they have to have enrolled in My CA Vax, the state system. They have to use My Turn, and they have to sign an agreement with the third-party administrator, Blue Shield. We are currently, this will be the first week of that we transition the way that allocations are made to vaccine providers. So last week, there was one mechanism, the mechanism we've been using since vaccine began to arrive in Monterey County, one mechanism for allocating. And so in that system, the county receives the allocation notice from the state. We communicate with providers through the week to decide what's the most appropriate amount of vaccine to go to each provider. And we submit that order to California Department of Public Health, which approves the vaccine, and the manufacturer sends that or delivers the vaccine to each provider. This week, there are two mechanisms in place. We still have the first mechanism. That's for providers that haven't yet transitioned to the third-party administrator. Again, we'll receive an allocation for that entire group of providers. We will communicate with them like we usually do, determine what's the most appropriate dose shipment that they should receive, and we'll submit that to the state for approval. And they'll receive their doses next week. The second and new mechanism that's taking place this week is one in which we will provide input to Blue Shield, the third-party administrator, on allocations for providers that have transitioned to the third-party administrator. They've signed agreements and agreed to all the requirements that the state has laid out for receiving and administering vaccine. So we will provide some input to the third-party administrator. The third-party administrator will make the final recommendation of the number of doses to go to the providers that have transitioned to the third-party administrator. And they'll make that recommendation to the California Department of Public Health, who will then approve the allocations, and the manufacturers will then ship those allocations of doses to those providers that have transitioned to the third-party administrator. And that's my update for this week, ma'am.
Thank you very much, Dr. Moreno. And then we'll go ahead and get started with questions. I've got a couple already in. The first question is for Lauren and the United Way on our rental assistance program. How many people can be served by the emergency rental assistance program? Ballpark figure.
So, we don't really know exactly how much money people owe, but estimating that if folks owed about $3,000, dividing the money available, that would be around 9,400 people.
Okay, thank you for that.
I think so much of that really depends on the individual,
Right.
the background need. I think that SB 91 really set up the whole 80%, the landlord needing to accept and to forgive that 20%. The intent really is to help support as many households as possible, and that we really try to flex that money as much as we can in consideration with some of the eviction moratoriums and other pieces to SB 91 to help just make sure that money goes as far as possible and keep people from evictions and becoming homeless. Something
And
to
I'll
add,
just
Katie?
add, yeah, just because we don't have a ballpark figure as was pointed out, but we know it's going to be thousands, and it's going to be thousands of households, which is of course, could be a very large number of people. So we will be reporting back, as the program continues. And so we'll know at the end of the day. We could probably take a guess now, but it will be we will make a large dent for sure.
Well, if you had 400 on your soft launch, imagine when it really gets out there.
So yeah, and a lot depends on what that pent up back debt is.
Correct.
So we will find out, but we know it'll be thousands that will be able to help.
Thank you very much, all of you. Next question is for Dr. Moreno. How many genomic sequencing tests has the county health lab conducted to determine if those infected with coronavirus were infected with a COVID-19 variant? Does the county health lab perform tests on those who have died from coronavirus to determine if they were infected with a variant? And if so, how many deceased people had a COVID-19 variant?
Thank you, ma'am, for the question. So I don't have the number of individuals, of specimens that were tested by our laboratory, but I can get that for you. And then as far as who gets tested, we actually are looking for a wide, a variety and diversity of specimens ranging from hospitalized patients, outpatients, skilled nursing facility patients. And so, for example, and so we're really trying to broaden the type of specimens that come to us, meaning we want it from a variety of different type of people that have been tested so that we can be a little more generalized in saying, being able to say this applies to as much of Monterey County as possible. So we don't focus on one particular group to test, because then if we just tested individuals in skilled nursing facilities or just tested people who have died, then all we can say is among people who have died, this is the percentage, or among people who are in skilled nursing facilities, this is the percentage. We want to be able to make it usable by as many people as possible. So we really look for a broad range of patients and specimens from those patients. So I couldn't tell you whether any of those patients died or not, but I can tell you, I'll try to get the number and get it back to you.
Thank you very much, Dr. Moreno. And another question, I'm hoping that you might be able to answer this question. If not, we can try to pass it along. Did Monterey County sign the contract with Blue Shield?
I can, I don't think Mr. McKee's on the phone. He often takes those answers, but I can tell you, answer some of it, I think. In public session yesterday, the Board of Supervisors were presented the recommendation to sign a memorandum of understanding with the state, and the recommendation was to sign that memorandum of understanding. Monterey County won't be signing an agreement with Blue Shield. That was something that was a change in plans by the state. Originally, Monterey County and other counties were going to sign the agreement, but many counties felt that it was more appropriate to maintain our longstanding relationship with the state of California, and that counties should work directly with the state of California, and the state agreed with that approach. And so that's why Monterey County Board of Supervisors agreed to sign the memorandum of understanding with the state.
Thank you very much, Dr. Moreno. And then I've just got one more question for you, at least for now. Regarding the Blue Shield partnership, is there any change in how people book vaccine appointments going forward? Is it still primarily through mcvaccinate.com, or pods or clinics or primary care doctors, or will local residents have to use MyTurn exclusively for appointments in the future?
So that's a very good question. I think that depends on each vaccine provider as they sign the agreement with the third-party administrator, that they meet the requirements. From what I understand, some organizations may be able to continue to use their electronic medical records for scheduling appointments, for example. However, from what we're told, at some point, the vaccine provider will need to utilize MyTurn, because MyTurn is the statewide system that brings in all the information in a consistent format so that the state can monitor progress across counties. By using a similar format, there's consistency in the way data is transmitted. So I think at this point we'll find out how each provider intends to use MyTurn, which may or may not affect how an individual makes an appointment. But we're hoping that it doesn't affect where people get appointments. We hope that our vaccine providers continue to be accessible to the populations that they've been serving, so they can continue to vaccinate those who are waiting to get vaccinated.
Thank you, Dr. Moreno. And I have another question related to the MOU, which you described just a question ago. What is the advantage of signing an MOU with the state? Does it increase the supply of vaccine for the county?
So just about every county has or will be signing the MOU. So it's generally, for the most part, it's the same MOU across the state. And there is no increase in vaccines available to California. So signing the MOU I don't believe would have much of an impact in terms of any counties getting additional vaccine, the state will, working with the TPA, the state will continue to do what it can to get vaccine into the state of California and then turn around and make those available to, for now, local health jurisdictions to allocate to providers who have yet to be transitioned over the TPA, and some of that vaccine over to the TPA to get vaccine out to providers who have transitioned to the TPA.
Thank you. And then there was a nearly identical question that came in after when I just asked you. So the reporter who's turned that in, I hope that Dr. Moreno's answer answered your question.
Do you want to go ahead and read it? I'll go.
I'm pretty sure that it did. What does opting out of the Blue Shield plan mean for counties and for clinics? Does this change anything? And I think you just explained.
It's a little different. There might be one or two counties who haven't been convinced that they want to sign on. As at this point, we don't know what the consequences will be for those counties if they choose to not sign the MOU.
Okay, thank you. That is all the questions that I have in chat for today. Giving it another few seconds. Nothing more has come through. That will wrap up our briefing for today. Our next media briefing is next Wednesday, and we'll see you then. Thanks, everyone.
All right, thanks, ma'am.
Good afternoon.